I'm Tara Barney. I'm coming to you today from the headquarters of where we've been trying to keep the business and civic community informed for the past year and a half about our efforts to successfully manage through the many surprises and challenges that the COVID vax challenge has put in front of us. And we're back for one more of those iterations today. Over the past few weeks, as the Delta variant has caught hold in our region, we've had hundreds of questions literally from businesses and organizations looking for the kind of guidance that we always want to make sure we provide to the extent we have it. And we have been at this since last March, so it's been much longer than I ever hoped. Our intention has been and will continue to give you the best guidance and the best access to information that we can possibly provide for this community. That said, every business makes their own decisions. So I understand that we'll give you good guidance and good information, and we will also always continue to do all we can to provide best practices among the organizations in our community. So that's our intention today. So today we're going to take care of a little housekeeping first. So the first thing I'm going to ask is I would love to see next to every one of your pictures that little sign that says you're on mute. So if you'd please mute your phone if you're not. It's not that we don't want to hear from you, it's just that it raises lots of interference when we've got many people on this call. And we've got far more than 100 folks on our call today, 120 right now. I also want to take just a moment to say a special thank you to those who have joined us for this meeting that are actually bringing you the content. So Mayor Winnicky is with us. He's had a busy day, I know. And so we thank you for being with us, sir. Central through this whole effort has been the leadership from our health department. The Vanderburgh County Health Department, represented by Lynn Herr and maybe others today, is with us and will share some pretty current data with us all. And I will speak to this in case Lynn doesn't get around to it. Our health departments throughout the region stay in close touch. So when she can bring us information on data and advice from the Vanderburgh County Health Department, it's a pretty good indicator of what you'd hear from any of the health departments throughout our region. Also, because the Evansville Regional Economic Partnership is a newly formed entity that consists of the former Chamber of Commerce, the former Coalition, and the former Growth Alliance for Greater Evansville. I will share with those of you who are not regular participants in our call, but for the past year and a half, we've been getting together every month to share information on how the COVID variant has been impacting our region and other important data as we've merged the organizations. Why am I telling you this now? Because we continue to have available for your use on our website access to the most current information from both of our health systems, from the state of Indiana, from the health department. There's a whole list of good sources that you should go right to and use when you want to know the latest and greatest on this latest iteration of our pandemic. As a technical matter, you can get there through the EREP website, or you can go to the SWIN Chamber website. During our merger, our three websites are still alive, and a lot of the good data you need is on the SWIN Chamber website. So I just want to give you that technical advice. And so now I'll leave one other thought. This is a town hall, so that's where we share information and hear from people both. As a practical matter, the way we hope to hear from you is through the chat. So if you haven't used the chat, you'll see it down at the bottom of your screen. It looks like a little thought bubble, and you can put a comment in there that goes to everyone on this call, should you wish to. You can ask a question that way, or you can send direct information to any of us that you wish. I will monitor the chat, as will Lynn Herr, and we will do our very best to make sure that questions that come up from the data we're going to share with you today get a response. Those that we may not get to, we will do our best to make sure you do get a response. In that regard, just to be upfront, we're probably not going to engage in a lot of conversation about opinions today. We're going to try to stick to the facts, stick to the data as we know it, and make sure that we give you the best direction we can for your business or your organization. I've invited a number of the members of the EREP board who happen to practice law to be on this call. I thank you all. I've made it clear to them, and I want to each of you, that they're not giving you legal advice. They're joining us as members of our board to offer you informed thinking. Your best legal advice is going to come from your attorney, your accountant, your financial advisor. So always feel welcome to remember that the advice and counsel we provide here is to give you directional guidance, but you should look to your own professional colleagues for anything specific that you want to make sure we cover. That's about all the housekeeping I've got to cover. So I want to thank you all for being with us again today. This is hugely important to our region. We went through a lockdown last year, which it crippled so many of our businesses. I won't even repeat the story because you all know it. That said, our region has been extraordinarily resilient and done a magnificent job, I think, of coming together and managing through this. And most of our employers are back in operation in some form or fashion. Many are thriving, many are still challenged. We've got an array of partners working to make sure that those businesses get all the support they can. But we're not through this turmoil, even though we'd hoped to be. So this is an opportunity for the business and civic community to show a lot of leadership collectively and to do all we can to make sure that our region continues to manage this effectively, not only so we can run our businesses and be profitable, but because it is the way that we show care and commitment to all those that make up the population of our region and that are our most valuable asset, not just because they're our neighbors, but they're our employees. And I think that if there's one piece of wisdom I can impart, because I am nothing but a generalist here, it is the fact that this Delta variant is hitting our workforce very hard. And so that's my lead into our agenda for today. Here's the agenda. Dr. Porter put together a pretty interesting presentation that he gave to Rotary recently. So we asked him if he would freshen that up and share it with us today. I believe, although I can't see him, that Dr. Dan Perrott is on from Ascension, and I think he may have comments to add as well. And then I know Lynn will share some up-to-date information from the health department. Our intention in these first information moments is to answer many of the questions we've gotten. So I've got pages of questions from you all, and we've shared those, and likely we'll get to most of the questions that have come our way so far as we share this information. But again, our interest is to make sure that if you have a question that we're not getting to, put it in the chat, direct message me if you want, or share it with all if you think that's more appropriate. So with that, I'm looking around to see if there's any immediate high signs, and I don't see any. So to all 150 of you that have joined us today, thanks for being with us. We appreciate the fact that this is an important enough topic for you to spend some time with us. And I'm going to ask Dr. Porter if you'd like to share your screen and tell us what's new and what we should be preparing to think about, sir.
Okay, Tara. Let's see if I can get my screen share going there. Are you able to see my screen?
You look good. Yep.
Okay, great. So as Tara said, this is really primarily a talk that I gave last Tuesday at the Evansville noon Rotary. Excuse me. So anybody who was there and heard that, you're going to see pretty much the same information. We do have some updated data that's as of this morning that we've put into the numbers, but let's go ahead and get into it. So we'll talk a little bit about the Delta variant, what exactly it is and why it's different. We're going to talk about what we're seeing as the trend from an infection prevention, infection control perspective in our community. I'd like to talk a little about vaccines, and then we'll finish up talking about what we can do as individuals and as a community. And I think for this gathering, considerations for what we might be able to do as businesses. And again, if anybody has questions, please make sure those are raised as we go along. So let's start by talking about the Delta variant, what a variant is. Variants are essentially a new form of the same virus that has come about as a result of what are called mutations. And this is one of the challenges with viruses like SARS-CoV-2 is they're very adaptable and they tend to mutate. In fact, when the initial talk about developing a vaccine started, one of the big concerns was how frequently and to what extent will this particular virus mutate. And believe it or not, it's actually mostly a good news story about mutation with SARS-CoV-2, and that is that the vaccines were extremely effective early on and have continued to be effective for the primary endpoint, which is preventing severe disease and hospitalization. With some of these types of viruses, they mutate so frequently and so much, you really just can't stay on top of them with a vaccine. So it's really mostly been a good news story from a variant perspective as it pertains to the effectiveness of our vaccines. However, what we have seen is, and this happens often with viruses as they remain in circulation in populations, be it animals or humans, that the longer they exist, the better they get at doing their work. And their work is to infect suitable hosts, replicate as many times as they possibly can, and do that in a way that increases the likelihood that they'll be transmitted to another suitable host. That's basically their lifestyle. They're looking to find suitable hosts, reproduce as frequently as possible, and then spread. These viruses tend to do that primarily on our nasal and oral mucosa. So if you're out there and you get exposed to someone who's shedding this virus, some viral particles get in your nose, in your mouth, in your eyes via a variety of different ways, but we know with this virus mostly that's droplets in the air. Then it finds a suitable place to take root, if you will, and start replicating. And if your immune system is not able to prevent it, it will do its natural course, which is what I described earlier. So the Delta variant is just SARS-CoV-2 with some changes to those. In these depicted in this picture, these little red things are the spike proteins. Those are the surface markers that our immune system recognizes as foreign when it is introduced into our bodies. Those have changed enough that this variant is more efficient at attaching to the mucosa where it's a good place for it to set up shop. It's more efficient at replicating itself, so it creates higher numbers of itself in our bodies once it gets started. And then probably primarily because of those two factors, that it's better at attaching to our mucosa and it's better at creating high numbers, it's more contagious. Unfortunately, it's also resulting in a higher percentage of people who catch it being hospitalized than some of the other variants. Why is it called Delta variant? You know, with so many things with this pandemic, as we have more information, as we get more experience, things change a little bit. Our understanding of things change a little bit. So we had started with the variants just naming them their number and letter designation, which tells scientists what exact mutations that particular variant has undergone, and then referring to them often geographically based on where we first noticed them. At some point along the way, that got really messy, and the World Health Organization recommended we switch to a Greek letter designation. So the main variant that circulated where we saw our last big surge was the Alpha variant, and now we're to the Delta variant. And there's a Sigma variant that's out there circulating around somewhere as well. Actually, Lambda. I mean, the next one is going to be called Lambda. So that's a little bit about the Delta variant. We are seeing it affect younger people, and I'll show you that in some of the data. Our average age of hospitalization with the first surge was in the seventh decade. Late sixth and seventh decade. We're now seeing our average age of hospitalization more in the fifth decade of life. So we're definitely seeing younger people being hospitalized and more even younger people. So there are more kids and young adults ending up hospitalized from the Delta variant as a percentage than there were with the Alpha variant. It's still uncommon for that to happen, but when you take really large numbers of people, uncommon things can still result in fairly large numbers. So we are seeing, for example, our children's hospitals around the country where there are places that surges are going on are filling their beds up with kids suffering from COVID-19. Breakthrough cases is something we want to talk about a little bit more as well, but I'm going to wait for a future slide to touch on breakthrough cases. So our most frequent infections now are in the 19 to 44 age group. That's representing 46 almost % of our infections. The data on the right here is from the beginning of the pandemic. So this is showing still that most of the admitted patients were in that 6th and 7th decade. I will tell you now, our data is showing about a 20% spread between the 55 to 64, 45 to 54, and 19 to 44. So about 60% of our hospitalizations are now in that 19 to 65 age group compared to what we were seeing previously where the vast majority were in that 65 and over age group. So we are seeing that age spread go down. This graph depicts positive tests. So this is number of people who've tested positive within Deaconess. The red line is percent hospitalizations, and the orange line is percent positive. So this was our biggest surge back here, November, December, January, where we saw our previous highest numbers. And as you can see, what has tended to happen is as the surge increases, we get more positives. The percent hospitalization has actually tended to drift downward just a little bit because so many people are testing positive. Fewer of them on a percentage basis a little bit required hospitalization. Our percent positive of tests goes up, obviously, as our number of positive tests goes up. It is a little different this time in that, so we're seeing our positive tests go up. This percent hospitalized line hasn't dipped like it did with the alpha variant surge. In fact, we're seeing it continue to rise a little bit, and that's reflective of what you're hearing nationally, and that is that the Delta variant is resulting in a higher percentage of hospitalizations than the alpha variant. And that's interesting because when the alpha surge hit, we really didn't have an effective vaccine at that time. So a lot of the older, most vulnerable people were getting infected, and that was driving hospitalizations. A lot of those people did get immunized when they had the opportunity because they were especially concerned about their risk. And so now we're seeing younger people in a higher percentage of hospitalizations with the Delta variant. This graph shows admitted patients versus ventilator use. And so you'll see we got up to a max, our maximum at Deaconess, I think, was 157 patients on a particular day between our Midtown Gateway and Henderson hospitals. And we're back, this is now the Delta surge, so we're back on the rise. We're up to 129. So 112 of those we've confirmed aren't vaccinated. I think this number is a little low. We know for sure the people who are in our system, and we have the documentation of their vaccination. So I actually think this number would be that the percentage would be a little bit higher even than 87% not vaccinated. These are the ones we know for sure. So we're back on the rise, and if history repeats itself compared to what we've seen in places like Southwest Missouri and Arkansas, where the outbreak, and now Florida, where the outbreak is worse, it's likely that this number is going to exceed that 157 that we saw as our maximum back with the previous surge, which is not a good thing. Ventilator usage had been really low. We were down to 0 ventilator patients at one point at Deaconess, and we're back up to above 28. I think we're actually around 30 today, patients on ventilators as a result of SARS-CoV-2. This is what's driving the fact that we're on a surge, our percentage of immunizations. We have seen these increase just a little bit, but not enough. And this actually looks good compared to some of our surrounding counties. So Warwick County is leading the way at 61% vaccinated, still not enough to get us to herd immunity, but certainly better than the 44 that we see at Gibson. Vanderburgh at 51. Illinois had more than one county in the 30s, so we have seen those come up now into the 40s. We still have Saline County just under 40% at 39.7. And Kentucky, we had more than one county in the 30s last week in Kentucky, and now we're just at Union County at 32.8. That's really low. Davis over in Owensboro at 50%, Henderson at 44, Hopkins at 46. So we would need to see those numbers significantly higher to really be able to head off this surge that we're currently seeing. So let's talk about vaccine misinformation. One of the things that is true is we are seeing breakthrough cases. So not everyone who's fully immunized is going to be able to avoid getting reinfected. We knew that from the beginning. No vaccine is perfect. The question is just always, what are those percentages going to end up looking like? With the alpha variant, the vaccines that we have provided still very good in protection, probably in the upper 80% to low 90s of not getting infected at all. With the Delta variant now, we're seeing higher percentage of people who are fully vaccinated catch the infection. Fortunately, though, the efficacy at preventing severe disease and hospitalization is still similar to what we saw with the Alpha variant, and that is probably somewhere in the mid-90% range of effectiveness if you're vaccinated at keeping you from being hospitalized or require intensive care stay as a result of a COVID-19 infection. Why do breakthrough cases happen? Well, the Delta variant is able to evade in some people a little better the immunity that is granted as a result of vaccination. But their immune systems are still being more effective at fighting the infection once they become infected than they would if they were naive, if their immune system hadn't seen the virus or the vaccine before. So that's why we get people who are infected, had been fully vaccinated, but mostly not getting particularly ill. Are the people who are fully vaccinated and get infected contagious is another question. And the answer is probably so. In fact, we're seeing similar viral loads in the testing that we do on people who are vaccinated and test positive as people who are unvaccinated and test positive, which means the viral particles that they're shedding are probably similar, and so they're probably similarly contagious. And that viral load is substantially higher than what we saw with the Alpha variant, which again is reflective of the fact that the Delta variant is just more efficient at replicating once it gets into our bodies. So you'll hear some people out there quoting data. Well, it's not quoting, yeah, I guess you would call it data. It's not really accurate data the way they quote it, but quoting data from the VAERS, V-A-E-R-S database. That's the national database where we track all vaccine adverse events. Anything that happens to someone temporally associated with a vaccine is entered in this database, whether it was caused by the vaccine or not. So if you think about what happens when you get, 30 million people in a database, there are going to be a certain number of those people who are going to have strokes, heart attacks, seizures, respiratory failure, deaths. And the only way you can make really useful information out of the data that's in this database is to do sophisticated analysis of it. You can't just go in and start reading through the lines and say, oh, this person got the vaccine and they died, so there you go, it killed that person. And when we're doing that sophisticated analysis of the database, we're seeing there are really very few serious adverse events directly associated with the vaccine. A very tiny number of people, and not with every vaccine, but with some of them, probably have developed blood clots. That's more likely with the Johnson & Johnson vaccine than it is with the mRNA vaccines, and was even more likely with the AstraZeneca vaccine than any of the ones approved in the United States. However, even with those cases associated with the vaccine, it was still less than 1 in 150,000, and the risk of catching COVID-19 and having a blood clot as a result of the COVID-19 infection is much, much higher than the risk of getting a blood clot related to receiving one of those vaccines. So that's a good example of how you could look at the VAERS data and say, well, there are people in there that had blood clots, surely it must be due to the vaccine. Not necessarily. People have blood clots just as a normal course of their life when they haven't had any medicine or vaccine. And I like to give the comparison of, you could create a database of everyone who took a vitamin today in the United States. It would be hundreds of thousands, probably millions of people, and some of them are going to have a heart attack, have a seizure, die, have respiratory failure. It's not due to the vitamin that they took this morning, unless they overdosed on some particular vitamin. So further, I think, exemplifying the fact that the misinformation is rampant, there are 12 individuals who are responsible for producing 65% of the misleading claims that are out there on the internet. These people just hate vaccines. It really doesn't have anything to do with COVID-19. They hate vaccines of all forms, regardless. And vaccines are one of, if not the most important scientific breakthrough, medical breakthrough, really in the history of the human race. We were at the mercy of infections like smallpox and polio with nothing we could do about them until vaccines came about. And obviously they've completely changed, the way we live, and we don't live in fear of so many of those diseases that killed a lot of people, young people in many cases, in often very awful ways. So, we benefit today significantly from the development of vaccines, and the vaccines that are available for SARS-CoV-2 are in many ways exactly the same as vaccines that we've had for many, many years. The mRNA vaccines were developed and do work in a slightly different way, but the RNA that's introduced in our bodies isn't in there very long, less than 2 weeks, and it's completely undetectable in our bodies. So it isn't like it's something that can hang around and cause long-term effects. It comes, it does its job, and it's gone. Additionally, our physiology is not capable of putting mRNA into the nucleus of our cells. If it were, we would have a lot bigger problems with RNA viruses. They would just go into the nucleus of our cells, and the viruses themselves would change our DNA, and we probably would have gone out of existence as a race a long, long time ago. So mRNA can't do that, even though, you know, people raise all these concerns about it potentially is going to change or genetically modify human beings. It just isn't possible for that to happen. So lots of misinformation out there, lots of good information out there too. If you want to go read about just about any topic that I've talked about or that others are bringing up, there's lots written by very reputable organizations. The Society for Healthcare Epidemiology of America is really the premier organization that looks at infection and infection prevention in the world. It's not made up of politicians. It's made up of scientists, physicians, nurses whose life's work is dedicated to treating and preventing infections. They've got some great information out there that I strongly recommend people go and look at. Infectious Disease Society of America, again, these are the preeminent infectious disease physicians in our country, and their information is unequivocal and unanimous that the vaccines not only are important, they're our only hope of getting out of this trouble that we're in with this pandemic. So lots of other organizations. I'm a member of the American Academy of Pediatrics. I'm a member of the American College of Physicians. Both organizations that I trust and that put good information out. In addition to that, Deaconess's website has really good information and links to a lot of these, as does Ascension Health. So, you know, your own healthcare providers have websites that can link you out to useful and valuable information. What do we need to do? We need to get people vaccinated. I mean, we would not be having another surge if people had taken the vaccine. We've got more than enough vaccine. More than enough availability in our vaccine clinics. If people would just go get vaccinated, we wouldn't be on a surge and be contemplating what else are we going to have to do. So to get that done, we just have to keep educating people, hoping that they will eventually get, you know, whatever question it is they have answered, or perhaps become more concerned about the surge and the risk of being infected than they are about the vaccines. And I think, you know, we are seeing that around the country, that the vaccination rates have crept up a little, just not to the rates we need them to. Unfortunately, we do need to mask up again. The breakthrough cases mean we need to mask up whether we're vaccinated or not. And believe me, I'm not any more happy about that than you are. I hate wearing my mask, but I don't want to infect people. And I don't want to not know that I'm contagious and infect people. Mostly, I don't want to not know that I'm contagious and infect someone and kill them. And that is a risk with this virus. And you just won't know. You'll live ignorantly blissful to the fact that you went around, were contagious and didn't know it, infected someone, and as a result, they died, you know, as a result of the viral particle that you shed from your body and introduced into theirs inadvertently. We do still need to physically distance. This virus is more contagious than the Alpha variant. So it's been compared in contagiousness to chickenpox, which is highly contagious. Not as contagious as, for example, measles, but still highly contagious. So if you get in a room with someone who is not masked and has the Delta variant, where there are millions of viral particles being shed from their bodies, the likelihood that you're going to get it if you're unvaccinated is high. If you are vaccinated, there's still a chance you're going to get it. The best data we have right now, and this will change as more data becomes available, is the vaccines probably offer at least 50% protection at not getting infected with the virus at all, but still a fair amount of risk. There's some data right now that looks like the Pfizer vaccine has about 50% protection, and Mrna may be a little better. Mrna may be as high as 80% protection against getting infected. The good news is all three, Johnson & Johnson, Pfizer, and Mrna, are still offering well above 90% protection against severe infection and hospitalization, probably in the mid-90s still. And that bears out in our numbers. We are seeing very, very few fully vaccinated people require hospitalization. And when they do require hospitalization, most often they're recovering quickly and not requiring a prolonged hospitalization. So it's what we've been preaching for a long time. Location matters. If you're outdoors, if you're in a big room with lots of ventilation and high ceilings and you can spread out, that's much safer. The smaller the room, the less air mass there is in the room, the less air circulation, the more risk. Obviously, further away from people is better than closer. And the more time you're around someone that's contagious, the more likely you are to be infected as well. All things that we have learned and knew for a long time. So that was the heart of the presentation. We do have some information on our website that's specifically for businesses. It's at deaconess.com/COVID-19 for businesses. So there's another resource, a place that you can go and look for accurate information. And Tara, I'll stop sharing my screen and I'm more than happy to answer questions.
Well, thank you, Dr. Porter, as always. So much great information, so efficiently presented, and with your particular angle on it. So I've been using the example of, if you eat a hot dog, you don't know what's in that, so go ahead and get a vaccine. But I like the vitamin even better, so that's going to become my #1 example now. There are quite a few questions. A couple of them that I'll just aggregate have to do with the booster situation. Is that something you want to speak to at all?
Yeah, sure. So the FDA has gone ahead and agreed that boosters are appropriate for a subgroup of people who are immunocompromised, not because the vaccines don't work, but because their immune system means they probably didn't have a good, robust response to the vaccine the first time they got it. And the more we give the vaccine, the stronger the immune response is, even in immunocompetent people. So people who are immunocompromised, and that's a really specific subgroup of people that have cancer, under treatment for cancer, have an immunodeficiency, things like that. So the vast majority of people still don't need a booster. Are the rest of us going to need a booster? Possibly, maybe, probably. At some point, most vaccines, your immunity does wane somewhat over time and you need a booster somewhere along the way. Will that booster then be developed in a way that gives us additional protection against a variant? Probably. The manufacturers are working on both those things. There is good data that shows, even in people who are fully vaccinated and had a really good response to the first round of the vaccine, they have an even stronger response after a third dose, which probably would give even greater protection. So as more of that data becomes available, the guidance on when and whom a booster is appropriate for will likely change.
Thank you. There are a number of questions coming in here. I try to summarize some of these, but one I think, Dr. Porter, that you might be best able to speak to is what we know or think we will see as far as the curve on this surge. Is there any sense of that?
Yeah, so the Delta variant surge has tended to have a very steep slope, and then less of a prolonged plateau. So it tends to drop off faster after it peaks. And that, from beginning to end, has looked to be sort of a 10 to 12 week kind of duration of when it started circulating in a community, then progressed to the steep slope, and then had a brief plateau and then dropped off pretty precipitously. So probably in total, it's going to last less amount of time than the other large surge that we had, but it probably is also going to peak at a higher number than we previously had. And that period of the really steep slope to dropping off, we don't really know for sure, but probably somewhere in a 2 to 3 week kind of time frame where we see the worst of that.
Well, I know a lot of our public partners, school superintendents and others have had to make calls based on their best information. I'm pretty sure they're getting it with advice from you and the health department and others. So that does seem one of the things they've been considering.
I see several questions, Tara, about natural immunity from people who have been previously infected. We do know that people are being hospitalized who have been previously infected. Similarly to that, there are breakthrough cases from the vaccines. We also know that for a variety of reasons, the immune response to the vaccine appears to be a more robust immune response, probably because of the way our immune system is presented with that spike protein and given an opportunity to form antibodies to it. There's probably something about the way the mRNA vaccines do that make our immune system able to produce antibodies to different parts of that spike protein that it normally wouldn't produce antibodies to, and that probably makes it a more robust immune response. So certainly there are people who are having breakthrough infections who were previously infected. We don't have that data. There are a lot of factors that go into that as well. When were they previously infected? You know, how long does that immunity last? We know that there is some immunity from natural infection, and we know that it did last longer than we were originally thinking it probably would. We also know that the immunity from the vaccines is probably superior to the immunity from natural infection, but I don't have exact numbers, and I'm not sure that anyone does at this point on people who have previously been infected and then subsequently hospitalized. I'm sure that's being tracked and studied somewhere. I just don't have the data on it.
We know we'll be able to get it from you when you have it. I see some questions about masking and effectiveness. Would you like to take that, or is that a question for Lynn Herr? But I think that people probably need to hear a little bit more about what's best in that space, you know?
Yeah, so let's talk about masks a little. There's a lot of information out there about the fact that viral particles can pass through masks, especially if they're not an N95 mask. And that's true. One of the reasons that, you know, the CDC initially was saying, and people like Dr. Anthony Fauci were saying masks are probably not going to help, is because we do know the viral particles are very small and can pass through many types of filters. However, what we saw in practical experience after that initial information was put out there was that the virus is mostly transmitted on respiratory droplets, and that masks are pretty good at knocking respiratory droplets out of the air as they come out of your mouth, which is why we said masks are probably better at preventing the infected person from spreading it to others than they are preventing you from getting it. But if there's a respiratory droplet in the air, your mask will probably be pretty effective at catching that droplet before it gets onto your mucous membranes, and certainly reducing substantially the number of viral particles that make it to your mucous membranes, and that increases your body's ability to stave off the infection. So we have good practical data that shows, and here are some ways it was studied. So there are examples where there were large groups of people gathered, one or two people who were contagious and then ultimately known to be infected and contagious. In the groups where there was no mask wearing going on, the R factor, the R0 factor, the number of people that contagious person infected, was much higher than in similar situations where there was someone who was ultimately known to be positive and contagious and everyone was wearing masks. In fact, in the latter, we often saw that no people caught it, even though there was someone in the crowd that was contagious, that was wearing a mask, and others were wearing a mask. If there were people that caught it, it was substantially lower numbers that it was spread to. So all those things are true then. When people are saying on the internet viruses can pass through masks, that is true. However, on a practical basis, they're good enough at blocking the respiratory particles, and most of the viruses aren't dry. They aren't floating in the air on a dry fomite, which would allow them to be a smaller particle size. So that's probably why they aren't passing through the masks and infecting people where people are wearing them.
Thank you. Please keep your questions coming in. We're trying to organize them as we talk. Lynn Herr from the Health Department. May I ask you to share what's most current from the Health Department's perspective, especially because I know that some of the questions we have coming in from employers, and I'm seeing them, Cindy Staples, don't worry, we'll get to them, are things you probably have some insight on.
So again, thanks to Dr. Porter, because I think he really took the edge off a lot of people's concerns. But I kind of want to explain what the health department's role is and all that. And that's basically to support our community to follow the CDC recommendations. And that's around vaccine, and that's around mitigation of COVID disease as well. And how we're going to do that is mask wearing in the workplace. We do support that and those CDC guidelines, social distancing when at all possible, still cleaning recommendations, but also actually testing, contact tracing, because that is how we mitigate disease. So we want to be there as a support for those individuals. We also want to be out there, and we currently doing it today, on-site vaccination clinics And that allows us to break down any barriers of people leaving the workplace to go get vaccine. We do have all 3 vaccines here available at the Vanderburgh County Health Department, and we would be glad to kind of put that on the road. We do know that the local hospitals, that there are vaccines available everywhere. You know, our Indiana is ourshot.gov, but we also have vaccines.gov. You click on Indiana, you click on Vanderburgh County, and you just get a whole lot of different spots that you can go get vaccine. So, but if we can bring that to you, that's ideal. One of our other jobs here at the Vanderburgh County Health Department, besides as being a resource, is also following local trends. So Dr. Porter hit some of these really well, but also we want to empower business to be able to go to coronavirus.in.gov. That allows us, and I know people were following that early on with the county being blue, the county being yellow, the county being orange, but that really gives businesses and everyone the idea of the number of cases that are being reported, whether that's going up or whether it's going down, and that positivity rate, the number of positive cases compared to the number of tests, and where we are in that. And not only for Vanderburgh County, but those surrounding counties, or from wherever your workforce is coming from. Again, also drilling it down to actual zip codes. And we do see disparities within zip codes. We know that our downtown area that has been kind of revitalized, our 47708 is 82% vaccinated. But then we also turn around and look at our 47713 zip code, and it's as low as 45. So this allows us to actually make educated decisions on where the bus that the mayor is supporting us is to go, to be able to break down any of those barriers. But one of our true concerns is actually looking at the racial disparities within our community. So we currently know that 83% of our white population has been vaccinated. But then you turn around and you look at our Latino community, and if your business is either serving the Latino population or employing the Latino population, it's only 2.4% of that population is vaccinated. Our Black population is down to 6.3%. So our job here at the Vanderburgh County Health Department is to work with local leaders within our Latino and our Black population to really try to up those numbers. Even one of those things that's kind of missing right now is a good relationship and formation with our Asian community, which is 1.8% vaccinated. So we really have work to do within this arena, and we're willing to work with anyone within those arenas if you have ways of reaching them. Again, looking at those very closely. We also look at and get reported every day those individuals that are positive. So we really have the opportunity to break down those age groups that Dr. Porter had kind of looked at. And just last week, from the 8th to the 14th, that week, we had 842 cases within Vanderburgh County. And 75.5% of those were ages 20 to 69, our workforce group. So again, we're really looking at those individuals that are sick or within your workforce. So again, getting back to the mitigation of disease and how important contact tracing and isolation and quarantine really is. Those guidelines for isolation and quarantine really have not changed over the months. There may be new guidelines that come out, but we're not seeing any change from those. But we do know that as people quarantine and isolate, how important that is to the mitigation or the slowing down of disease spread. one of the great kind of statistics that we've received from the Indiana Department of Health is if you're unvaccinated, you have a 1 in, if you're vaccinated, you only have a 1 in 237 chance of being hospitalized. And we know that for the unvaccinated, that rate really just jumps up there. We know that really current breakthrough is fairly low. And Dr. Porter kind of hit on that as well, that are fully vaccinated across the state of Indiana is less than 2% or 0.2% of those individuals are actually being seen in the hospital. So we do have a lot of information here at the health department. Again, we want to be as a resource, and we want to be as a resource to going in and vaccinating and breaking down any walls within business.
Lynn, may I ask, because we got so many employers on this call, is there a way we can be helpful in getting to those populations that are less, if we've got employer resource groups or that sort of thing, are there ways we can be part of this equation and getting to those populations that are have had less opportunity to be vaccinated? I realize there's a trust factor too, but
well, there
anything
is.
to say to that?
Actually, the businesses that we have been in, we've had a very good response and being able to get those. And I'm just going to put those out. AmeriQual and Anchor Industries have had great responses with their minority populations.
Well, I know Dave Connor's on the call, so I'm glad you mentioned Anchor. That's great.
Yes, yes, and we've actually been in Barry, and we did have good responses with the minority populations. And again, their employers supporting vaccination and then breaking down, not having to leave the job site to be able to get vaccinated. And we want to be those kind of folks.
Well, I know that there have been free concerts for those that are vaccinated. Many of our employers are using incentives as a way to identify who's been vaccinated. Many of our employers have taken the larger step to using more of a stick, in that they've started to put some specific requirements in place. Laura Scott, one of our board members, had a couple observations on that. Laura, would you share with us just a bit what employers should be thinking about in this space as they decide how much authority they have to manage this with their employees?
Sure. Well, the number one question that I'm hearing a lot of employers ask is whether or not they do have the authority to mandate that their employees get vaccinated if that's what the employer wants to do. The very short answer to that question is yes. Employers do have the authority to mandate that their employees get vaccinated. Employers that are thinking about instituting that kind of a mandatory vaccination policy for their employees do need to make sure that they're putting processes in place to make accommodations for their employees that may have a disability or a sincerely held religious belief that might prevent them from being able to get vaccinated. But in general, yes, employees or employers can require their employees to get vaccinated.
I know we've seen some companies of national scope take that action. I know Lilly's taken that action, and I think some of our employers are considering it for certain parts of their workforce. So, you know, again, I am just a journalist and the convener of this conversation, but I think it is something that we've seen the business community have a lot more opportunity to engage in. I will remind everyone on this call that's in the business world that Indiana, as a state, took action this year during legislative session, which provides a level of liability protection for employers that are taking actions that are responsibly considered. And you know, so you have some comfort that the state of Indiana has given you some support from the potential liabilities here. I do want to call on Maria Del Rio for a second, because she asked a question in the chat that I think we're all interested in, and that's what's coming in the kid space. I realize this is a business call, but if employers have one challenge, it's their employees' children and how carefully they are protected. So Maria, lob the question out there, would you please?
Sure. I had asked Lynn, and I want to say that I am a member of the Vanderburgh County Board of Health.
Mhm.
So I asked Lynn to speak up related to the vaccination rates for our smaller children. Children are going back to school, and you can get, and children can spread the disease like adults too, not as much, but they can. So, so you can have a child that's at home that has to stay at home because someone else is positive, because the child is positive. We know that children don't get as acutely ill as adults, but, and like Dr. Porter said, our pediatric intensive care units are getting full with very sick children. So this is a little more severe and more significant than the previous surge that we had. We get an update from the state health department and then locally from our epidemiologists every week. And as of last Tuesday, we'll have an update on tomorrow. And then Lynn, you can add to this. The data shows for Vanderburgh County specifically that 12 to 15 age group for Vanderburgh County, the vaccination rate is 2.8% of all 12 to 15-year-olds have been vaccinated. 16 to 19 years old, 4.4%, and 20 to 4-year-olds, those young people that maybe work in some of your businesses, 5.8%. So even though we have a total high percentage compared to other areas of vaccination, our younger people are not vaccinated. And this is, I guess, echo what Dr. Porter said, what Lynn has said, that is so very important to get everybody vaccinated. There's a lot of concern about getting the children vaccinated. Jim, you can talk a little bit about this, but the American Academy of Pediatrics encourages the parents and the providers to children who are over 12, that the vaccine has been approved for them, to get vaccinated.
And just like any other vaccine, Dr. Delaware, we know how we cocoon our youngest folks, that they can't get the vaccine, and by us being vaccinated, we protect those individuals. And the information that I have is so close to yours that there's no sense in any difference. We do know that last week of those cases, we had, of the total cases, less than 1 was 1.2% of the infection. 1 to 4 was 2%. 5 to 11 was 4.9, or almost 5%. 12 to 17 was 5.1%. But then you get up to our 20 to 29-year-olds, and we're up to 22.7% of the infection. So again, those younger adults really showing us. And of course, this was the week before we went back to school, or the first week of school, but we are working very closely with our school corporations to provide a safe environment for those individuals as well.
But be aware that Lynn's data is those who are tested positive. I'm talking about vaccination rates. There could be a lot of positive children that are asymptomatic, that are unvaccinated.
They're not being tested. We know that there's a lot of folks out there that are not being tested, especially those children who may be asymptomatic, or the adult in their world doesn't want to take them for a test and be that traumatic test. So again, we have to be concerned about our little folks and cocoon them the best we can. And that means those individuals around them. And we know as a business, when the child is out and the parent has to be out to care for the child, that is a stretch on our work capacity as well.
Mhm.
Yeah, so just, and thanks, Maria, for bringing that up. It is really important point. And so I have 3 daughters. All 3 of them are immunized. 2 of them had COVID, and then we got them immunized after they had COVID. And we didn't do that because I wanted to be able to get on a call like this and say all 3 of my kids are immunized. We did it because we love and care about them, and we knew it was the right thing and the best thing for them. So I like to draw the comparison to the chickenpox vaccine. Not many of us know a child that died of chickenpox, but children died of chickenpox, and it was tragic when a child died of chickenpox. It's tragic when a child dies of COVID-19, and not a lot of them do on a percentage basis, but it's preventable. And the thing that's just so hard for us as physicians and in the medical community to get our heads around is we have all this incredible amount of data now with tens of millions, hundreds of millions of people getting these vaccines. they just aren't hurting people
Mhm.
in any numbers that matter at all. COVID-19 is hurting lots and lots of people all over the world, and it's preventable now. And that includes kids. All these kids that are in pediatric intensive care units, on ventilators, having long COVID symptoms, having, immune system problems as a result of the infection. At this point, if they're old enough to get the vaccine, it's preventable. And because of HIPAA, unfortunately, we aren't able to talk about a lot of details of what we're seeing in the hospital. But I will tell you, like other places around the country where this Delta surge has happened, we're seeing so many examples of people who are young, and we've had young people die, and young people die saying, "I wish I had gotten that vaccine."
Mhm. I think there is a gap in we gentlemen's understanding of the difference between people who had a test and we know are infected, and the many, many, many that have probably had some level of COVID and we don't know because they haven't had a test. And so I assume the Delta variant has got a iteration of that that's moving around our community. Is there, would you counsel people to go get tests more often than they are getting them now? Is that helpful?
Yeah, because you don't want to be contagious and not know it, Tara. And one of the things that has changed that we didn't talk about with the Delta variant is the symptom profile has changed a little with it. So, previously, if people just sort of had the sniffles, we didn't think that was likely to be COVID-19. Seeing a lot of more people now present with what seem like pretty typical cold symptoms. They think, no, I probably don't have it. Go get tested, and sure enough, they're positive. So I would say if you have what you think might be a cold or a sinus infection, or if it's your allergies, especially if it isn't exactly like, that a certain pollen count went up and these are the exact symptoms that you always have, that probably is your allergies. But if it isn't really following the pattern that you're normally accustomed to, I would say get tested so that if you do need to quarantine yourself, you know that and you don't inadvertently hurt someone.
And do you want to speak to the tests that are available in the pharmacy these days?
I think if you have access to a test, get the test at this point. I don't think we ought to spend a lot of time talking about the benefits and drawbacks of the various tests that are out there. Some are better than others. The PCR test is still the gold standard, and those can be turned around pretty quickly. So if it's me, I'm still going to get the PCR test because I know the false negative and false positive rates of some of the different tests that are on the market. That said, I think there are some out there that are perfectly adequate for what they're being used for. And if you have access to a test and you need it, just get the test.
I think that's an important point that we will try to pick up on and work with our employers, because many of our employers, HR folks, probably would welcome a few guideposts on when they should have information on testing again, because I think that people have, I had quite a few tests in the beginning of this effort, and I've not thought to have one recently, nor do I think I have symptoms. But that may be something we can do to help the employer community provide some useful guidance for their operations. I know we've got, go ahead.
The other place testing does come in handy, and I think this is relevant for employers, and Lynn probably may want to weigh in on this too. So the guidelines for isolation have a provision for if you get tested, then you can potentially shorten your self-isolation by a little bit by having a negative test, and that's regardless of whether or not you're symptomatic. Other than that, if you don't have symptoms, there probably isn't a lot of utility in just getting tested asymptomatic, unless you're part of an intentional screening program where they're trying to create a bubble or something like that. Then there is a utility for routine asymptomatic testing, but just in most people living their normal lives, there probably isn't a lot of benefit to that.
So again, definitely, Dr. Porter, we don't encourage people before the 5th day, if they're asymptomatic, not to go in and get testing. It's a waste of resources. People sometimes, when they immediately are exposed to someone, they go right in and get a test, and that is kind of a waste of our resources. There are instances in which, especially in long-term care facilities, in which they're instructed and they kind of test their way out of positives. And that's because they're working with really high risk individuals. And the fact that people can return to work faster with those CDC guidelines, again, that's with mask wearing and social distancing being in place. And in the business world, sometimes that's really hard to do to be able to do that. So again, if people are, again, and I hear, how early do you suggest symptomatic patients getting tested? When they're symptomatic, we want them to be tested. Again, if they're symptomatic, please get tested. If they know they've had a known exposure, not before the 5th day.
But then I think if you do have a negative test after the 5th day, you can shorten the isolation to 7 to 10 days instead of 14, correct?
This is correct. Again, we just want to make sure that people know that, you know, if symptoms do arise, then that they back off of that.
Thank you, Lynn. And again, there's so much data out there, and sometimes it's just exhausting to get through it. So we will continue to try to sort the data that responds to many of these questions we're getting, and point you toward our experts and have guidance on our website for these things. I know there's a lot of employers on the call that have engaged in some best practices and are having some success with them. So if you are one of those and you'd like to share what you've been doing, please either direct message me or just be brave and come off mute and share it, because I think where we're having some success with practices, it's the sort of thing we will make a point of sharing among the community, so you can either use that information yourself or be in touch with your fellow employers.
Tara, there's a question on here that I hear a lot about, do you have to, after you've tested positive, how long do you have to wait to get vaccinated? And the answer is you don't have to wait. We were telling people to wait 90 days in the beginning because we were trying to stretch out the limited supply and availability of vaccines we had compared to demand, but that's no longer an issue. So you don't have to wait. And then the other question I think is a good one is on there is, if you're symptomatic, should you wait to get tested? No, if you develop symptoms, get tested right away. No need to wait at all at that point.
So you've heard that from our pros, get tested immediately, no cost. Some other questions that are on here that I'm gonna just call out have to do with communicating this information. As you can tell, it's a little complicated. I know that our local media do their best to cover these things. And so I saw a few questions asking why these details aren't out. I know that many of you are on this call, so please feel welcome to get in touch further, and we'll do all we can to help you have the best information possible, which really means I'm going to point you toward, Ascension or Deaconess or Lynn or one of the experts that's on this call. But I do think that the role of our media in communicating this information is huge. I would say that in the work of the Evansville task force over this past year and a half, one of our huge partners has been the local media in being available to share this information. Mayor, do you have anything to add to that? Because I think that they are important in this, and we want to make sure that anything we can do to make sure the media has good information, we will continue to do. Dan Parod just posted. Can everyone see Dan Parod's post? It should be in your chat. It's information on the chances of you being infected. Cindy Staples, do you want to speak to the question you raised? I'll get her off mute if I can.
Yeah, sure, if I can get off mute. I was just curious as to if we thought that employers requiring a vaccination was going to be more of the norm so we can still get people back to work. I'm still working from home. And fortunately, I can do that. But I knew some employers were requiring it. I didn't know if that was going to be the norm and what other people were doing.
Well, I am not the one to answer that question, but I will share the few anecdotal elements I have, and that is quite a few of our larger employers have come up with a combination, masking in closed circumstances. As I said, more carrots than sticks that I've heard so far in ways of encouraging vaccinations. But I think that in that effort to get more people in the workforce vaccinated is broad-based in our business community. A lot of businesses are looking for details on that. I'm looking at my members of the board that are on this call. If any of you have further information, Laura or Ted or anybody else from your clients, be happy to hear from you on it.
I think the only thing I'd add, Tara, is I think it very much depends too on what kind of a business it is. If it's a business that has a lot of contact with the public, if there's a lot of close contact, I think employers may have a certain bent towards requiring vaccination of their employees, both for their own safety and for the public that they come in contact with. If, on the other hand, it's a business that can be operated with workers working remotely, or there's not a lot of contact, or you have a lot of people in offices spread out various places, then employers may be looking for a bit softer approach where they maybe aren't going so far as to mandate the vaccine, but are putting incentives in place or are doing other things to encourage their employees to get vaccinated, either through breaking down barriers, some of the suggestions that Lynn was making about getting vaccination clinics to the employees directly through their employer, or providing transportation, or again, taking away some of those other barriers that employees may have to getting the vaccine.
Thank you, Laura. I appreciate that. I think it's complicated information to sort our way through. I am looking at the questions. I think we've covered most of those that seem broad-based, but I want to make sure that if there's a question, well, we've got the expertise on this call that we have. I don't want to miss the opportunity, but I will report a couple things. One, we will be staying in close touch with the state. I just saw a question from John Harding. It's a good one. Where is the state on this? So far, the state is watching the infection numbers county by county. And so I think that some of those things are possible. We're certainly considering for our larger events, going back to opportunities to make sure that everyone is spread apart and that we are encouraging masks to be on people's face properly as we post those events. So we'll be working in that area ourselves as an organization, because we do host a lot of fairly large events. We want to make sure we're demonstrating good practices. But I think that as the state imposes size limitations, they'll be front and center in how we distribute them by email, by social media, and certainly on our website. So we get that information to you the second there are any material changes in this. The other thing I want to remind everyone of is that we are recording this, and the recording will be available on our website. So if you find it useful to go back and look at the questions or look at any of the information that's been presented by Dr. Porter, which we appreciate greatly, sir, that will be available to you at your convenience. But I'm going to take this opportunity to thank you all for your time today. I hope this is useful to you. We will continue to be available to you. So as questions come up, get them to us. You can always get them to us through email, social media, or there's a comment section on our website. And to the extent that we find things are changing dramatically, you can count on us standing up other town halls to discuss this surge more broadly. We'll also keep you in the loop as opportunities come forward for the next iteration of children vaccinations and that sort of thing. And you can count on us engaging businesses that are engaging in best practices with each other. And as we find information there that's relevant, we'll be sure to share that as well. So for all the months you spent paying attention to our website as a useful broker of information, I'm re-inviting you back to that as a source. But first and best sources are absolutely our two hospital systems and our health department. So what we'll do is repeat the guidance they give us. We are being proactive about staying out of the speculation space and just reporting on good data. So I want to thank you all for what you're doing to help manage this circumstance, because the collective leadership of everyone on the call is important as we work our way through this. And I very much want to tip my hat to Mayor Winnicke and his team and all that have been involved in this effort so far. And I want to express, I think, my thanks on behalf of everyone on this call, to Dr. Porter, to Dan Parad, I see Janet Reiser on this call, to all of you that are in the healthcare business, and certainly to you, Lynn. I know the Vanderburgh County Health Department has been working 24/7 for more months than you want to think about. But we are blessed to have this kind of collective support and the opportunity to get good information and to share it on a regular basis with you all. So thank you for being with us today. I'm going to take this opportunity to end the call, not because I don't like seeing your faces, because I know you all have a lot of work to do. So again, many thanks for being with us today, and stay tuned. We'll keep you informed as things change.